All right, we are open. We will let people.
Oh, did you want to change your name?
Yes, thank you for that reminder.
That worked well yesterday.
Thanks to folks who are joining us. We see you coming in. If you want to share where you're joining from today, that would be awesome. Make sure to share with all panelists and attendees so that everyone can see. Hi, Erica. We're
New
all
Yorkers.
Oh, England, awesome. Yes, we are recording today and we will be sharing the video. It'll be a link that you can share with any folks who weren't able to join.
Jody is joining us again from yesterday from Montana. Welcome.
Yeah, and Joe from Nevada, thanks for being here. Awesome, Canada.
Hello, Canada. Oregon.
That's your region, Michelle.
Yes. Sri Lanka. Hello, welcome. Minnesota. Croatia, welcome.
Oops. Yeah, some folks are sharing. There's two ways that we can see messages: to all panelists and to all panelists and attendees. One of the things when in just a moment, we're going to ask what folks hope to get out of the session today. And please do go ahead and change the drop down under by 2 to all panelists and attendees. We're going to have some SJN staff joining us today as well. They might be able to answer some of your questions, provide links and feedback. So it's helpful if everyone shares to all panelists and attendees.
Yeah. So it looks like it's time to get going. So hello and welcome. This is the webinar from Solutions Journalism Network. This is Advancing Solutions Journalism Coverage Amid the Coronavirus Outbreak. You are in the right spot. My name is Michelle Faust-Ragavan. I am the West Coast Region Manager for Solutions Journalism Network. That means I work on the West Coast with everyone who touches the Pacific Ocean as well as Arizona and Nevada. And I'm here with Sarah Gustavus. Sarah, you can introduce yourself.
Sure, I'm Sarah Gustavus. I'm the Mountain West Region Manager. So I work with newsrooms and journalists in Montana, Wyoming, Idaho, Colorado, and New Mexico. Before joining SJN, I worked in public media, and so did Michelle. So we're going to be talking about print stories, digital stories, radio and TV stories. All right.
So basically, we're here to kind of advance this conversation. We had a conversation yesterday, and we're going to move things a little bit further and take your questions. If you have any questions right now to get started, we're here to answer those. Does anyone have any questions to start out? Any things you want to cover? Please do post that for all panelists and attendees.
And there are some folks who attended yesterday. We did a 101 of solutions journalism and reporting on COVID-19 right now. We're going to cover a few things that are similar to what we talked about yesterday, but go a lot deeper into those examples. Also talk about sourcing and evidence more. Really going to be speaking to editors, reporters, people familiar with solutions, but just not quite sure how to get started on solutions coverage for your audience right now. How small newspapers can do solutions journalism. Sharon, that's a really great question. And Michelle and I both work with newsrooms of different sizes, large metro newspapers and TV and radio stations, very small papers. I have some newsrooms in my region in the Mountain West that are just a couple of people, and there are strategies for doing solutions journalism with a really small staff. Oops. Any more things that people are hoping to get out of today?
So basically, those of you who are talking about you're coming from a small newsroom, if you're a small newsroom who's already doing some even small investigations, any kind of enterprise journalism, you can do this. And there are folks who are doing this in short stories, things that are 800 words. There are people who are doing this in much longer stories. Of course, when you have a longer story, you have more space for all of the different pieces. We'll be talking about the 4 pillars of solutions journalism more today. And that basically, that is what you need. If you've got the 4 pillars, you are there, and we'll be defining those and talking about that more in detail as we go.
These are some really great specific comments of things that folks are working on right now. Jody working on how COVID is affecting the disability communities in Montana and public safety workers, really important. I think lots of folks are looking at that. I'm gonna make some notes here, and when we get to a longer question part, I think we can discuss some of those. Bringing solutions into daily news coverage that is more like continuous breaking news coverage. I think that is the challenge for everyone right now. That's exactly what we're seeing and exactly why we're having this webinar today, because it is possible to do solutions coverage right now to incorporate it into those daily updates that you're doing in a newsroom or if you're a freelancer. Also, issues tied to the really disenfranchised from Paul, homeless, foster youth, street papers like Real Change News and Street Roots are no longer helping the homeless with newsprint. We need to focus on those people who never make it into the mainstream, even in small community news. I think that's important of making sure that we're looking at lots of different communities that are impacted right now in the outbreak. The role of PR in helping or hindering stories, how you should avoid pitches from brands and orgs sharing their solutions. So we're going to talk about evidence and sourcing, which is a great way to stick to the side of, good solutions journalism and not PR. I know yesterday we did have some folks who work in strategic communications trying to see how they could use the principles of solutions journalism in their work. And we're definitely open to folks using it in that way. But this webinar is particularly geared for folks working in journalism and other folks who can learn from it. We welcome you being here today as well. All right, just to review what we're going to be doing this hour, we're going to review what is solutions journalism, and what we're doing now is talking about the 4 pillars of solutions journalism. So if you went through a training with us years ago, it's the same principles and values of solutions journalism, but we're really talking about the 4 pillars today, and that's because it's a great way to understand and to share and to train solutions journalism to new journalists or student journalists. If you work with student journalists, we're going to look at some examples using the 4 pillars of solution stories and strategies for applying these techniques to covering COVID-19 right now. And I just want to emphasize again that this webinar is targeted especially for folks who are committed to solutions journalism. You've done it in the past, but you're saying, how do I do it now? I've heard from lots of journalists in my region, lots of journalists outside of the Mountain West too, saying they want to do it, but they don't quite know where to start. And that's exactly why we're here today. All right. So solutions journalism is at the heart rigorous evidence-based reporting on responses to social problems. When I do workshops, I like to tell people this goes beyond nice people doing nice things. And there are lots of stories out there right now. I mean, I just was reading one this morning from New Mexico, where I live, about a guy who does manufacturing, really specific manufacturing. They said, hey, we can take part of what we're doing and we can make guards, shields for healthcare workers. We could do that right now. And so that's a great solution. And they're focusing on nonprofits that need that right now, that can't pay for it. But it wasn't quite a solution story what I was reading, because we don't know how many, we don't know how scalable it is, but it's still a great story right now. So everything that we're talking about today is not to say that the stories about individual people doing incredible things to help their community or try to step up aren't worthwhile. They're very, very worthwhile. But we're also going to be talking about how to take those responses and look at them on a larger scale, how communities could replicate them, how we could replicate them across an entire country or across the world, what we can learn from those responses by looking at the evidence, looking at limitations, and the pillars that Michelle's going to talk about more in just a moment.
Okay, so the pillars are, and they're the 4 that we always talk about: the responses, the evidence, the insights, and the limitations. When we're talking about the response, we really want to have a how done it, as we call it. How did they move from, or how are they trying to move from one specific problem, make sure that problem is well defined, so it's clear of what we're talking about. Often we're talking about a piece of the problem, not how can we make everything better with COVID. There's going to be a lot of different responses to getting there, but looking at how that was. Also, we want to make sure that there is evidence. How effective is it? Right now, we're talking about things that are very new. When we're talking about, especially with COVID itself, it is a novel virus. So things are new. We are doing a lot of working on trying to understand the virus itself. But there are a lot of other things that are approaches to making life around COVID and in the time of COVID better in one way or another. Some of those things are not new, and we can look at evidence of the way that has been worked in the past, and some of those things are new, and so we have to deal with, okay, what evidence do we have? How much evidence do we have, and how much can we lean on that? Then we want to make sure that there's some insight. This is really getting us to better understand both the problem and better understand the solutions that are being posed to support and respond to that problem. Not just inspiration, but really something that's going to make you really understand how that could be done. And also we want to make sure that we're always discussing the limitations. There are no silver bullets in this world. There are always things that work well for one community and maybe not as well for another community. There are caveats, and we want to make sure as journalists that we are highlighting those and not ignoring those, to make sure that our work does not sound like a puff piece or public relations. And I love this mnemonic. This is one of my favorite slides, and it's just to help us remember those 4 pillars. These are the questions that we want to ask ourselves. Do we have the whole story? What response does it address? How it works? What's the how done it? Does it offer insight? Does it include limitations? And most importantly, does it provide the evidence of impact to know how well this is working?
And again, solutions journalism always, beyond the crisis right now, is reporting on what's happening now and the effects it's producing. We sometimes talk about imposters, things that are, interesting stories, but not solutions journalism. Those include hero worship, stories just about individuals without the insights, without the evidence, without the limitations. Also theories, think tank pieces, that's not solutions journalism. We're looking for stories about things happening on the ground. There was a great story, a great comment in our webinar yesterday, our 101 session, asking, what if there's something happening in my neighborhood? Is there something around the corner that I could cover? And the answer is absolutely. If you go ask people, if you go do that sourcing, go to people that you know are trusted sources in your community, there might be something already happening that you could report on with the rigor of solutions journalism. And if there's not, you can look to another community. How is another community doing things differently and getting different results? Look to another country. We have stories in our special collection on COVID-19 of how South Korea has responded, to the outbreak, how Taiwan, how China, we're looking for all these places. So it could be something very local. It could be something far away, as long as there's those insights that your audience can learn from right now. And you contextualize it for your audience so that it's not just a story about Japan, or it's not just a story about Korea. It's a story that informs the people that you're speaking to in your audience.
Some of that contextualization, as you're talking about, Sarah, is making sure that you're saying, okay, well, these would be maybe caveats for our community. Our community is bigger, is smaller, has a smaller budget, has been dealing with poverty. Those are things to consider, but you can still make those connections of things that have happened somewhere else that have been responses to a specific problem.
Let's go to some examples now. We have one particular example that we're going to go into in detail. If you joined us yesterday, it is the same example, but we've kind of presented a little bit differently. Maybe there'll be some new information for you here today, and then we have another example to discuss as well.
So this is a great example that I really love, and it's a New York Times article that looks at how they did this drive-up testing in Seattle of people who were suspected to have coronavirus. And we've got an annotated story that we'll share with you in the email. It would be that same annotation that we shared yesterday, but those of you who are here new, you'll get that as well. And so really, let's go down to those 4 pillars. The response basically is they have these drive-through COVID-19 testing. They have people drive through and get those tests. and it just looks like going for a fast food burger place, but except you're going by the hospital. Let's go to the next one. And because this response is really delving into the how, they give you the details. They take you along in the storytelling of how they did that. They have these cars stopping. Instead of being in a waiting room, folks are rolling down the window and sticking their head out just a little bit, and the doctors are putting the swabs up their noses. So it takes you on that specifically. How also has some details on how people are able to get cleared to be able to do that with a survey that they have to do ahead of time. So we have a lot of details on that, how this was done. And we've got evidence. So we've got evidence of how many people are being tested. They've got some numbers in there explaining that, even though they don't have the evidence of, you know, how scalable of this. They don't have every single detail, but they have enough evidence that this still qualifies as solutions journalism. Maybe a reflection piece much later would have a lot more evidence to be able to say how well this worked or didn't, but it doesn't mean that you can't do it right now if you've got some numbers to show, some things suggesting that this is working. And they're also showing that others are replicating this model, which is also some evidence that it's at least good enough that other people are willing to give it a try. Limitations, of course, this is not a panacea. There still aren't enough tests. Just because you came up with a better way to do the tests doesn't mean that we're able to solve the problem of a shortage of supplies. Not everyone can be tested because of that. They're only testing folks who have symptoms, which means that you can't get people before they start being symptomatic. So there are some caveats here, but we are looking at and addressing that because we're journalists and we show what we know and what we don't know. We don't predict the future. And the insights here, we get some details of the lessons that can be learned, the details that help us better understand both the problem and the response. We understand that, you know, because the waiting rooms are small in hospitals and people can infect one another, this solves that problem of people being in too close of contact and them not being able to get as many people. So they're able to do more because they have this. Again, we've got that insight here.
All right, this grid is a great tool that we will send to you as a handout when we send our follow-up email. You know, one of the things that we're encouraging people to do is if you're a reporter getting ready to pitch a story to your editor, then you say it's going to be looking at a response to a problem under inside the COVID-19 outbreak. You know, you can do this. You can make this a list for yourself or use this grid and say, what is the problem and what is the response? What are the insights that we can gain from this? What's the evidence and what are the limitations? That's a great way to be able to answer all those questions up front. Also, for the folks who are asking about how do we do this in the midst of constant breaking news in our newsroom, you know, this is one way to do it, is to kind of keep things straight in your head, to know what you're doing. And also, if you go through this and you say, you know, there's not enough evidence yet, maybe it's not a solution story, and that's not a terrible thing. It may still absolutely be a story worth doing, but if you have these notes, you can come back to it. You can do a follow-up when there is more evidence and say, okay, what do we know now that we can use the solutions framework to cover this story now? So it could be that you are able to do the story this week or next week. Could be that a couple months down the road when there's a little more information, a little more evidence, you return to it to do that great follow-up coverage to keep informing your audience on the responses and how we know that they're working or not.
And if you're working on a pitch, as you were saying, Sarah, you can look at, you know, I've got an interesting problem, but I need a little bit more of the how. I've got some ideas of different responses. You can put those questions in these little areas and kind of think, okay, what is it that I'm looking for next? I need more evidence. Who are the sources that I've leaned on in the past or that I need to find so I can find better evidence, or at least some anecdotes or whatever it is that you need, and then make sure that you're always keeping track of what are the limitations to that response.
There's a couple questions that came to us as panelists. Kate asked, is this a resource available in the SOJO Educators Toolkit? I'm not 100% sure about the answer to that, but we can check for you. There is, if folks are on right now and you do work with students, we do have an educator's toolkit. We can get you a link to that resource as well. Just contact us after the webinar and we'll connect you to the right people in SJN. A question from Virgil: could one of the pillars be absent and one of the articles still be a solution story? The answer to that is no. So if it's, for example, the question is there if there's not information about limitations, we wouldn't consider that a solution story. And that's the threshold that we use to decide whether stories get in our story tracker, which is a database of more than 8,000 stories. And we have a specific collection right now around COVID-19. And the folks who review those are supposed to be able to check off all these boxes and say, there is a clear response, there is evidence, there are limitations, and there's some sort of insights there. Insights can be, it can be limited if it's a really recent response, but at least if there's some acknowledgement of how other folks might use that information. But limitations is a really crucial one. You've absolutely got to include that. And part of the reason for that is as it differentiates good journalism. And in so many ways, solutions journalism is just good journalism. Michelle, do you have something to add there too?
Yeah, I would definitely, especially the limitations are extremely important, because the limitations are really the way that we change this from looking like a puff piece, looking like, we're backing up, this is a great response. We don't know that it's a great response until we have a lot of evidence. And right now, especially with COVID, we don't have a lot of evidence, as all of this stuff is coming out little by little. So we need to acknowledge, we don't know what's coming next. This has started new. Those are limitations as well, especially if you're talking about, if you're doing a 1-minute package for radio, you could say this is very new. We still don't know how many people have been who have not been tested, who are, whatever the thing is, but just think about those things. It can be a small detail, but we do want to have those 4 pillars. Those 4 pillars in a short piece may be a sentence each.
Here's another story. Lots of coverage, that I've seen locally in my area, that I've seen nationally, about restaurants and the really, brutal impact of these closures on the restaurant industry. And so this is an interesting story that we found where, the city is paying restaurants to make meals for folks who are experiencing homelessness. And there's a couple problems that it's solving. It's one, it's access to food, access to quality meals, for folks who are homeless, and also keeping folks in the restaurant industry employed. Because, we've all seen that huge jump in unemployment, claims across the country. A lot of those are service industry workers. Those are people working in restaurants, people doing all kinds of things in service and hospitality. And so this is a story saying, they're going to provide a certain number of meals, the restaurants are going to be paid, very much a how done it, of how it was set up, what they've done so far. And it's an ongoing response. And so I would imagine in a month, in 2 months, there will be even more evidence to add to this story. But it's a good example of kind of a quick turnaround, something happening right now and what we know right now. Michelle, do you have some thoughts to add to this story as well?
Yeah, I think so. And I think that the follow-ups to this story will be able to add a lot more evidence. The story was one where there's very little evidence, but they have something in there, enough to kind of make it a solution story. But the follow-up story that is able to say, this is how many people were actually fed, this is how much it cost, this is what the impact on the city. Those are details that would make this a much stronger piece. And those, these are the kinds of things that you're going to be following most likely. And so those are things to be keeping in mind. If you do that story, I can't remember, was it Virgil who asked the question of, I don't have all the pieces. Well, maybe you do the story anyway, but you want to follow that story and come around again, and then make sure that you're following up on it. And there are many examples. I'm going to push again. We've got the story tracker at solutionsjournalism.org, storytracker.solutionsjournalism.org, and you can look at a lot of stories there. We have right now you can click there and you will see that we've got a whole collection of responses around COVID-19 and what is being done there. I'll just highlight a few stories that I particularly liked. There was a lot of things about, like you had mentioned, South Korea, how Macau has had so few as compared to other places. What are the responses that they've done, and also stories, a lot of local stories. Again, people are talking about, how do I do a story in my local neighborhood? I don't have the resources of the New York Times. It's okay. There are local newspapers that are doing stories about how they're keeping seniors connected when they're in a nursing home, then they're not allowed to have visitors and they're not allowed to have folks around. You've got the problem of social isolation. That is a big health issue that has been reported on. What is being done about that now? Maybe we don't have a ton of evidence, but we can at least get some sense from the folks who are there of how many people are being connected, how often are they being able to talk to their families, maybe talking to those families to get some sense of how well this is working for them. All of those things could be adding and helping you with those stories.
All right.
And
so go ahead, Michelle.
I was just going to say, any questions so far?
Oh, there's a good question about short radio pieces. Michelle and I, you and I both worked in radio. This came up yesterday as well. Covering, government meetings, they often talk about the many things they want to do and present them as solutions, wondering how coverage of these plans in a breaking news matter could incorporate at least some solutions journalism principles, and especially how to source the content. Let's start with how you would do a short, very short radio story that is solutions focused. Michelle, you want to kick us off on that?
Well, I will, with the caveat of, with those stories, if it's a breaking thing and they're saying, we're going to fix all of this with this thing in a meeting, I would just do that as the headline, 1 minute, get people the information that they need, and make sure that I do follow up with the solution story that I would do as a slightly longer piece. That would be my preference as a solutions health reporter. How would I do that? I would make sure that I would see, the first question is, where did you get this idea? And that is where you're usually going to get the evidence of where else have they done it. Usually there's someone else that has done it, or there's someone who's researched that's done a trial somewhere with Corona that may be a little bit different, because there may not be as much, but always asking that question, where did you get this idea? That has led me to so many more stories that I wouldn't have found had I not asked that question. So that's my first thought. Did you have another thought, Sarah?
Yeah, so part of my background is covering state government, the legislature, and when I look back on my own work from years ago, where I would say, okay, they're talking about this, they're talking about that, lawmakers are going to pass this, this program, they're going to invest in this way. I really wish that I had gone back more often and done that follow-up story, or added to the story I was doing and say, who else has done this and what can we learn from it? Because a lot of times these ideas are not completely new. And I would say there's even opportunities now, and we are in unprecedented times with the COVID-19 outbreak. However, there are some similarities to other pandemics, to other situations, to things that you can just take a few minutes and go look at, what can we learn from something else in the past, or what can we learn from another place that has a few weeks on what we're talking about right now? What are those insights that we can add to this story? It's a great way to inform your audience, in new ways, and to really distinguish your coverage, from other outlets that are covering exactly the same thing.
Yeah, and I think, there are times when you do that headline story that you're able to put some evidence, you're able to put some limitations, you're able to have it all there. Sometimes, especially with the news cycle right now, that's why I say keep that for your follow-up, because you can go into it in more depth and have more for your audience. But it is possible. Again, it's just deciding what is that one piece of evidence that is important enough that you're going to highlight that above the other evidence, because you've only got that 1 minute or 45 seconds to tell your story.
And if folks have other questions or want to talk about specific topics, go ahead and put them in the chat right now. Make sure you send that message to all panelists and attendees. Michelle, earlier there was a question about remote sourcing. And I will say, SJN, we're working on a webinar just to speak to kind of the unique needs of remote sourcing and remote work right now, but we can touch on that today. How would you go about, finding sources, working remotely right now?
Yeah, I mean, we do have that slide coming up a little bit later, but the first thing I would do as an experienced reporter is I would go to the sources that I know I would go to my Rolodex of folks that I know are reliable, because that is going to be where I know that I can trust what those people are saying, that's where I would get started. And also working with those people to get your news sources, because people are all busy. So they can send you to other people, and you can at least have that reliable gut check of what's going on. A lot of people are doing really interesting things on social media right now. I have really enjoyed looking at some of the community forums that people are having, inviting the community to do community chats on Zoom. So they're doing some engagement to help them with their sourcing and have real conversations that sparks story ideas and helps with sourcing. And then I'm seeing people doing a lot of interesting things, especially in Facebook groups, where you can have those conversations that are really narrowed down to the folks who are interested in the specific area, region, subject that you're talking about.
I also want to talk about small newsrooms. It's really close to my heart. A lot of my newsrooms are very small in the Mountain West. One of the suggestions I have for doing solution stories right now as a small newsroom is to try to do a shorter story, is to make it really easy on yourself. Just hit the 4 pillars. Don't do a super long story, but make sure that you have a really clear response that you're covering. A clear couple of sentences about the evidence, or a paragraph about the evidence if you're in print. Talk about the limitations, talk about the local context, and also the insights. And that would be a really solid story that one reporter could do right now. If you need some ideas, some inspiration, the Story Tracker is such a great resource for looking to what's happening in other communities. Could you give you some ideas of an organization you could call in another city, or a source that you could call in another city, to add that additional insight and perspective into a local story? We have another question from Megan. There are lots of arts-related responses right now, but proving if they're effective is a little squishy. Still possible solutions journalism?
I think that all depends on whether or not someone has done the research. So if I am starting something that's artistic and I've got a certain group, and you're able to find the psychologist or psychiatrist who's done the research to show that these types of things have worked in the past, then you can use that evidence and help you. But yes, a lot of things, like we spoke about it yesterday in the conversation, is people are saying, oh, isn't this a great thing? We've got Netflix conversations that's going to keep people more engaged. Well, maybe, but what is the problem that it's solving? Is it making people less depressed? I don't know. It's a little bit too soon for that from my perspective, but maybe you're able to find the source of some evidence. It's really all about the evidence. Arts can be squishy, but they can also be, there's hard research about different ways that the arts can be useful for folks.
And there's that opportunity too, Michelle, where we have arts responses to, in the United States, hurricanes, natural disasters, other events that have happened in the past. There might be an opportunity there to do a bit of comparison, to contextualize. We don't have enough evidence right now, so to not overpromise and commit to what's happening right now, but to say, here's what we might be able to learn from and think about as this response is ongoing and as we continue to follow it.
Right.
Any other questions that folks have? Let's touch briefly also on folks who are disenfranchised. The specific examples were foster youth and people experiencing homelessness. Michelle, do you have some kind of ideas of how reporters and editors might be able to think about reaching those communities right now in the current crisis?
In terms of reaching with the social distancing is a little bit harder. I would look at, there's a lot of interesting things that are happening right now. I was listening to a story this morning of ways that they're using community centers that are now shut down. No one is in them. And LA, I believe it's LA County, is bringing folks from the streets into those places that have some showers, have some things that are available, and trying to make those resources and beds available for folks. But they're also trying to make sure that happens with social distancing. So I'd like to see some follow-up reporting on that. It's a little bit challenging. I would say that, depending on how you're doing your reporting with your editor or with your editors and your reporters, this would be some place where I would say I would mask up and protect and keep 6 feet apart, but also go out onto the streets and do that. We can also reach out to folks. And I saw something really interesting. I listened to something interesting on NPR this morning, and it was they had someone do voice memos on their phone, and it was just a string of voice memos of a person who's working at a grocery store and the concerns that they have. It was not a solution story, but they were able to narrate the whole way through with a lot of coaching from a reporter. But this story was really it was really insightful and interesting and very character driven.
Mm. Lots of great things emerging right now that we're continuing to keep track of. Okay, let's move on a little bit. We will come back to more questions in just a few minutes. So again, we're doing solutions reporting right now. There are some key questions that you can ask. And we often in our workshops talk about questions like, who is this response working for? Who is it not working for? What are the metrics that matter here? Because evidence is really challenging. It's not entirely a black and white answer in every single story. It's something to be discussed, with your editor, with your team. We have some specific questions that we've developed right now for the COVID-19 outbreak to look at where can you find, unique story ideas or angles of things that aren't being told right now? A couple examples here. What's working to provide health and safety resources for people experiencing homelessness, as we've just been talking about? What's working to optimize how schools are conducting virtual learning? And what's working to meet the increased need for ventilators and other hospital equipment? Sometimes there are solution stories that are a response, a community response, action that's being taken. Sometimes it's a tech solution. That can be a really interesting question too. But by using the 4 pillars of solutions journalism, you can do a great tech solution story that's not over-promising. That's not, as we often say, a magic bullet story of this is going to magically fix it. I've seen a lot of interesting stories about repurposing equipment or repurposing factories to make ventilators and other needed equipment right now. Those are super fascinating. To make them solution stories, we need to stick to the process of how it's being done, what the evidence is, what the limitations are, what the insights are for how we can scale that and replicate it and repeat it in other places, to stay away from hero worship of a particular individual or a particular company, doing things right now in the current crisis, and to also stay away from magic bullet stories of this is going to fix everything, because if they can only produce 5,000 ventilators, that's certainly not going to fix the need across the entire United States, and also not going to fix the need across the entire world right now, because every country is looking at this now, this need for protective equipment for health workers, the need for ventilators, the need for all of all of this equipment. We are going to send a link to this as well, to the specific COVID-19 questions blog. You can use that for sourcing, for story ideas. It's a really great tool. Let's talk about evidence. So for this,
I think this is a perfect time. There's also a question in the conversation about evidence. So I'll let you go ahead with that.
Yeah, let me check out this question. Squishy, I think we need to be more brave and go into what people are doing without a lifetime data studies. We have seen how bad science and technology and even peer-reviewed journalists have propagandized so much that journalists have taken a hook, line, and sinker because the sourcing has reams of evidence of validity. Solutions are supposedly solving problems, but the problems have never been addressed. So many in the choir are actually in this game to spin, and I believe journalists need to be brave and gutsy and go with their gut and be part of a narrative storyteller. I mean, that's an important point, and evidence is a really tough thing. It's something that I talk about with journalists all the time, because where is the evidence coming from? How do we know that it's the right evidence? How do we know that it's good enough? Just as we often say, there are no perfect solutions. There is not one solution that's going to work for every single problem or that would work in every single community. Really great journalism is going to dig into the details of how it's being rolled out, of what we're learning from it, what the limitations are. And so we have some tips for evidence that, yes, we want to be careful not to just, take the latest report. I'm starting to see a lot of that, of saying, oh, this medication seems to work. And so then the headlines are all, this medication might work, this medication might work. We need to kind of tone down the rhetoric a little bit and be very measured. And I know sometimes that isn't great for our SEO and, for getting clicks, but it's great responsible journalism to be really clear with people about what we know and what we don't know in new responses to this COVID-19 crisis. But what we're going to encourage folks to think about is looking at other places that are further ahead. If you're going to cover something local and the evidence is limited, you can temper that a little bit by including another place where the response has been going on for longer and what they know so far to add to your existing local evidence. Do use the best available data, and if you need help, get an expert who can help you evaluate whether or not that is the right data and the right evidence. Call a researcher, call an academic, call someone who's worked on this for longer, and get a gut check on that. I used to do that as a reporter sometimes when I was covering something unfamiliar. Lots of scientists I heard, and Michelle's a former healthcare reporter, would really rather help you get it right than to see it go to print or see it go to air and confuse people and spread misinformation. Folks will make the time to help you get it right if you ask. Michelle, do you have something to add to that?
Yeah, my only add to that is that, maybe not to, maybe my editors who might be on here would say, I took a lot of time with my stories, but there was a reason for that, because I wanted to make sure that the evidence was as solid as could be. And I wanted to make sure that I wasn't just running with, okay, I read this article. Did I actually read the whole of the study? Did I actually understand it? Are there other studies that are saying something different? Am I getting more than one source of evidence? If there's only one source of evidence, am I making that very, very clear in the caveats of, this is one source and there are other people who disagree, and making it clear how they disagree? All of those details are extremely important, or else then we have the risk of going in the wrong direction.
Absolutely. Also, I want to encourage people, both with coverage right now of this outbreak and with solutions journalism in general, to be transparent about what you know and what you don't know. It's a great way to build trust with your audience as well. We see solutions journalism as an opportunity to intersect with other needs in journalism today, one of those being trust building with audiences. And so that transparency really goes a long way to help with that. There's a question, if a story touches the hearts of people and inspires them to take problem-solving action, do you consider the story being qualified for solutions journalism, even though the story lacks evidence? The short answer would be no. It wouldn't go in the story tracker. It wouldn't be considered a solutions journalism story. However, it might be a story worth doing. Only you can answer that for your outlet, for your publication, for your audience. Is that the story that you need to tell right now? Maybe you want to return to it. Maybe we have lots of examples that we see. For example, I've seen stories about these Netflix parties and yoga studios and fitness, studios sharing, free videos online to help people stay active at home. Those are great and important stories right now. They don't have enough evidence for us to know if they're working or not. We might have to return to them later, but it's totally a story worth doing. And that, this is going to go on for many months, potentially for years. We're going to have to tell new stories all the time. So tell that story that needs to be told today. And if it inspires people, that's great. But if you want to do more solutions journalism, keep looking for those opportunities to find evidence that backs up your story, makes it a solid solution story that we can share in the tracker with other people. We've got some more questions coming in here. How valid is a study, as in how large of the sample is it peer reviewed? Michelle, do you have thoughts on that?
I'll send some more information on how to evaluate a study well. I think that's like its own webinar, to be honest, but we can send you a little bit more information on that. But making sure that you're reading the study from the front to the end and not just reading the summary or the conclusions. A lot of reporters get burned by that.
Mm-hmm. There's also a question. There are groups of people in Sri Lanka who work in small teams to provide food and supplies for the people in their area as the island-wide curfew is announced. Will this be a solutions journalism story? It absolutely could be. Yesterday in our 101 webinar, we talked about mutual aid, these Google groups that are popping up around the world where people are filling out the needs that they have, and they're also talking about what they can provide and trying to match people up to do that neighbor to neighbor, community member to community member, addressing those needs. You would want to talk about the evidence of how many people are they reaching, because if there's a difference between they can reach with these groups, they're reaching 50 families versus they're reaching 1,000 families. And so it's okay. It's not to say that 50 versus 1,000 is a solution or not a good solution or not a good solution, but it's also getting at the limitations. If you say, okay, right now they can reach 50 families, there's a greater need than that they're not meeting right now. That's a little bit of evidence of what we know now. It's also a really clear limitation of what would need to be done to meet the full demand for that program. So you could include both of those in approaching a solutions journalism story of that local response. I'll put a note in too to go ahead and include the mutual aid example again. There's a few of those in our coronavirus collection in the story tracker, a few stories about mutual aid. Linda also put in a reminder, please folks do put your questions to all panelists and attendees because some of our other SJN staff might be able to help you as well. Another question from April. I'm working on a story about a health app that aims to help people with their mental health and coping with COVID-19. There isn't much evidence yet for this one, although there is evidence people are turning to this app for support. The success of other versions of the app have been backed up by evidence. I'm speaking to people who are using the app for a realistic view of how this helped them. How much weight should we give to anecdotal evidence in solutions journalism? Michelle, as kind of a health perspective, could you weigh in on that?
I mean, I'm curious about the evidence on the other versions of the app. That's where I would lean in, that, you know, and making those limitations of saying, you know, we do not know, making it very clear in your caveats of your story that we do not know how that will transfer for this particular incident and this particular version of the app, but looking at the evidence that they have there. Yes, you do want to have some anecdotal evidence. Obviously, the gold standard would be have the anecdotal evidence and some numbers, and some strong numbers and some strong facts. Lean as far as you can into that. How many experts, how many great psychologists, psychiatrists in your area can say, this is something that I would use with my patients that I'm not able to see right now, or you know what, I'd pass on that. And maybe you have folks who say both and they give you a good reason why, and you're able to use those in your story. I would go on both of those. But really, the past evidence is going to do more to give you that insight that you need, to have some evidence, than just going with, we know this will work, because we don't.
Exactly. And to get us away from that magic bullet kind of stories that we see sometimes, that apps are going to fix everything. It's, again, I've seen the same, and I encourage people operating on technology and business of really being cautious about these new solutions, new tech solutions, new apps, new things like that. We have a great opportunity to do important, meaningful journalism by looking at limitations, by looking at evidence, instead of just saying this is going to solve all of our problems, because then we find out later the reporting eventually comes out about the limitations, and you can be ahead of the game if you go to that from the beginning. All right, Michelle, you want to take over talking a little bit more in detail about sourcing?
Yeah, absolutely. So I do want to let you know that SJN is working on, there's a form that can be filled out. We're sending that to folks who are spotting responses to coronavirus. Especially if you are a freelancer or you are someone who's just displaced and trying to look for a story, Julia can help you with that. Julia, if you can put your email in the chat, and you folks can reach out to her to get more information on how you can be connected to some of these stories. There's a limit so far, but we've got a few examples here. There are these care kits that are being delivered to certain folks in India to help folks who are in the shutdown in India, where it is a complete shutdown and people are not allowed to go to temple, they're not allowed to leave their homes. How are they being taken care of, especially very vulnerable groups? Transportation resources to help with food banks, that's in the United States. School programs to help people with their mental health needs. Again, we've got that. So there's a lot of things there. We're trying to get more of those all the time. And so we can help connect you if you need some brainstorming, especially if you're someone who's trying to do some freelancing for the first time, maybe after losing a job. Again, I want to go back to remember who your existing sources are, especially at this time when you can't knock on as many doors. It's going to be really important to know who you already can trust and who you already know. I don't call on that person anymore because I can't trust them, or that person needs to be fact checked. These are things that you already know, especially if you're a working journalist. This is where I would be leaning on at this time if I were writing a story right now. Folks are doing a lot of outreach on their newsletters to get people to submit different story ideas, letting them know that you're interested in looking at solutions. I've seen some really great things from the Google Forms that are out, where people are filling that out and putting that in their newsletters. Go to your existing, so if you already have a social media presence and you've got Facebook groups, lean on that. People are having great conversations and getting really good sources in there. And then remember, there's other types of technology that you can use. I made the example of the NPR story that I heard this morning, where they just had the reporter go, virtually go through with the person recording themselves, and the reporter did a lot of legwork of making sure that that person did it right. But it was a non-narrated story, narrated only by the character, and it was very effective.
Some of these Facebook groups that are popping up are specific also to coronavirus, to COVID-19. An example that we're going to share a link to is New Mexico in Depth, which is in my region, created a New Mexico coronavirus Facebook group where folks are sharing information. It's vetted by journalists. It has journalist moderators answering questions. So they're doing a lot of things with this group. They're addressing misinformation. They're making sure that, great sourced information, quality news coverage is being included in that group. They're also asking people about their experiences to not only identify gaps in services to people. For example, as we've been talking about, disenfranchised folks, very vulnerable, members of our community, trying to figure out what are those people's needs and are they being met? Where are the gaps? And also trying to say, where are things working? Where are people doing something that they could cover, that they could put their journalists on to do an actual solution story about things that are happening in New Mexico. There was a question earlier about pitching as a foreign correspondent. Our colleague Julia Hotz just put in her contact information in the chat. I would approach her. Jules works with freelancers, and so she's a great resource of how you can do solutions reporting as a freelancer right now. She can help you a lot more.
And I also wanted to talk about, there was someone who had asked a question about PR. And, I've worked with folks who work in PR who've understood that I am a journalist and I am going to vet and I am going to fact check them and I am going to maybe take their evidence, but look for other evidence that's independent and it's not provided by them. So I have had really good relationships with folks in PR, and I've had not as great relationships with folks who work in PR. It is really, I think it comes to the attitude of understanding first my independence, and second that I need multiple sources and I need a lot of things. The problems that I've had usually of when they want to just feed me the story and don't understand and are getting overly involved with my reporting process. So I wouldn't necessarily shy away from PR. Again, this is where I would go with who are the folks that you've worked with in the past that you have more sense of that you can trust them, and again, the folks that aren't giving you the best information at the moment. And vet.
Let's go back to questions now. Do folks have questions on what we've covered today, on the resources? Also tell us about, is there a specific need that you have either as a newsroom-based journalist or as a freelancer that you could really use some help with in your solutions reporting right now? We'd love to hear what's going on with you and see if we can match you up with existing resources, or go back to our colleagues at SJN and tell them what people need in the field right now. And these can be, I know we have folks on the chat today from inside the US, from outside the US, from other countries, and we have staff working with both US-based journalists and international journalists. So we welcome questions, needs, thoughts from everybody.
I like what was put in the chat from Michael. It says, solutions journalism provides hope with teeth. So we've got actual evidence that you can be hopeful about something, but there's a reason why, and also acknowledging those caveats.
Because we're hearing already, right? I'm hearing from people saying, oh my gosh, I'm so overwhelmed. I can barely watch the news, pay attention to the news. I mean, this is something that we've been hearing for years. This is part of why solutions journalism exists, because our founders recognized that journalism was doing a really great job of covering what's wrong, but not as great of a job at saying what's working and why, and what can we learn from that, and to bring both of those to the table, both to highlight, things in communities that need to be addressed, and also to highlight what's working and to highlight how we can learn from that. How can we share those insights with other communities? Now is the perfect time to be doing solutions reporting. Not every story is a solution story, but putting it out there of saying we are looking for solutions, to put that on the table in your editorial meetings and say, what's a solutions angle here that we could cover, is just additional important coverage for the people that you're serving in your journalism right now. We have a new question coming in. We're a twice monthly paper, and I've been thinking of devoting each edition to some kind of theme in order to avoid just being part of the noise. Any thoughts on what people are most desperate to hear that the national media aren't doing? That's an interesting question, and I think it's going to vary from community to community, but starting with, I would say, we're not hearing enough about solutions. I mean, we of course would love to see really great, rigorous reporting on responses to the many, many problems in this crisis. It's not just one problem. It's kids need, an education. It's people experiencing homelessness, it's people with disabilities, it's people who have compromised immune systems from other health issues, and accessing food and accessing the things that they need in this time of crisis. There are so many stories that can be told right now that need to be told to really inform people about all the details of what's going on right now. Michelle, do you have ideas on that too?
Yeah, I would go with everything that you said. The one thing I would add there, and we've already talked a little bit about it, is dealing with the mental health and the isolation. My biggest concern, as I've done a lot of reporting on the health of our elderly in this country and our growing population of elderly people, isolation for them, for anyone, can be a form of abuse, and yet we're telling people that they have to be isolated. So what is being done? Some of this, I've seen a lot of different stories, and every community is doing different things to try to keep people from being completely isolated. This has got to be a very difficult time, especially for people who are dealing with depression, people who are dealing with dementia. Those are questions that I have that I'm sure readers are also interested in, or audiences of other sorts.
And it occurs to me, Michelle, that there's a really powerful opportunity, as you were saying, for getting those first person stories from people experiencing those challenges in your community, a thematic look at different parts of your community. They're experiencing different things, and to add the first person storytelling in addition to the solutions coverage could be some really powerful, informative stories that would help people understand what's going on right now locally, and also contextualize that for what's happening nationally and internationally right now.
I see a question from Megan about, is anyone working on stories to curb domestic violence during social isolation? And I've seen lots of stories about the problem and sounding the alarm that folks who are socially isolated are at bigger, they're going to be in more problems when it comes to domestic violence, especially if they're already dealing with that. I have not seen a lot of stories about responses to that. I know that there are folks who are working on this. How well, I don't know, but that is a question to be asking. That I would be calling every domestic violence and violence prevention organization of what they're doing. I would be looking in Facebook groups around that. I would be looking for that story because I want to read it, and I want to hear it on the radio, and I want to see it on the television.
Absolutely. I think that often these people are on the ground, they're working so hard, they don't have time to be calling members of the media and telling them what's going on. But my guess is there's already some responses going on, and maybe even some connections to a broader effort that started before this that could inform people about that particular issue. It's an important one. Also a question from Laura. I struggle with the fact that I have to work from home. It's hard to write a good story that has real characters if you can only do phone interviews. I feel like this is even more important with solutions journalism stories. Any insights?
My biggest insight was like, try to be very creative on the way that you do your interviews. I would slow down my interviews and really have people walk me through their days. Try to use, get that phone out and get the video going and have them, just turn it on and go with you so they can show you those things. I know this is a struggle. This is not easy. It is not easy for anyone, but lean into what you have. And hopefully, your editors are being patient and we're slowing things down so that we can do better reporting and not just faster reporting.
Yeah, Michelle and I both come from public radio. And I think one of the things that, even when I was in the same room with people, asking people to give me a tour of something, asking for them to walk around with me and let me record it, often led to these really great moments on tape that made for a really compelling radio story. And I think you could do the same right now. You could ask for people to go to the window and tell you what they see, or tell you about what their kids are doing. Have people narrating that for you, whether it's a print story or a multimedia story, I think could really open up some opportunity to see through their eyes how they're experiencing that. And so you're not making that assumption, but you're hearing directly from them, which I think other people would relate to, because that's what we're looking for, right? And solutions journalism is exactly that. It's not dry stories that don't include people. It has compelling characters that people relate to and they remember, but it also has those 4 pillars that make great solutions reporting.
I want to point out, there's plenty of stories in what Paul has there in the chat. Basically, we've got breakdowns of all types of systems right now, things, and it would have reflections on all kinds of things. So we're seeing how our responses are not necessarily great. what are things that are working better? What other reporters can you collaborate with anywhere in the world who can share their sources, share their resources that you can work with and get a sense of how it may be working better? The question always is, yes, things are breaking and things are broken, but who is fixing them? And what is the level of how well that is working? Again, sometimes we've talked about this before. Sometimes what we're talking about is solutions that didn't get there, but they tried to fix something, but it fell apart. Looking at that, how that happened and how that didn't happen is really important. And those stories can be very interesting. We can also add to the email what are they called when it doesn't quite work, the not quite the broken solution?
Instructive failures.
Instructive failures. There we go.
Linda, our colleague at SJN, just added a survey. We would love for you to fill out this survey. Let us know what you need right now, what would be most useful to yourself as a journalist or to your newsroom, because as we've mentioned, we're developing new resources for journalists all the time, but we really need some feedback to know that we're headed in the right direction and we're giving you what you need. Please do fill out that survey either now. We'll also have it in the follow-up email. Another question, we're watching for data on overloading hospitals will show states earliest to adopt stay-at-home orders came closer to flattening the curve than those did not. When and if such data is released, would this be a solutions journalism story? It absolutely could be. Absolutely. And it's going to be maybe many different solutions journalism stories. Maybe there's an initial story about what we know, and then 6 months, a year from then, we know even more. It could be a story that you continue to update and you continue to inform people about information as we learn it, about what's working.
When you're talking about your local hospitals, when you're talking about your local areas, those are stories that are probably going to be coming out much later because we'll have data later. But there's already some data if you look at some of the shutdowns and some of the things that have already been working in Macau and Singapore. And, you know, in some ways, they've got an authoritarian nation that's able to put things into place very quickly and smaller population. But they did things that many other parts of the world did not do. And there's a result of it, of folks not necessarily getting, them not having as many cases and people not getting infected as quickly. You want to look at those different statistics and look at the outliers. Who is it working for? Who is it not? When you get a set of data, you want to look at not just how it's not working, but look at where it might, wow, why is it working here? And really analyze that.
And what they did differently. I talk about that all the time in my workshops. Those positive deviants are often great untold stories that can inform your audience. All right. So you can join the hub. Michelle, you want to talk about the hub a little bit more?
Sure, absolutely. We have the hub, and there's a lot of great information there. You can go ahead and explore that on your own. Where I'm going to really point to is this part where it says get trained. We have a lot of modules in there that are specific to, if this is your first time at health reporting, how to do solutions around health reporting, education reporting, how to edit these types of stories. Those, you can do it at your own pace. Up front, it says how long it's going to take you. You can go in and go out. You know, if it's a 2-hour training, do 1 hour now and another hour later. But this is a really good resource for tools, and we're adding to it all the time. We're working on something for visual journalism. So those things are there. There's something there specifically for television. If you're working in television, those are a lot of resources that I highly recommend.
I'd also like to plug our collaborative playbook. Solutions Journalism has worked with collaboratives across the US for several years now. We've learned a lot about what makes collaboratives effective, and we're starting to see both our existing collaboratives that SJN works with in different parts of the United States and new collaboratives come together to effectively cover COVID-19. There's a lot of opportunity there for newsrooms to work together, to stretch limited resources, to support each other, to tell the important stories that people need to know right now through collaboration. So check out our collaborative playbook. And if you want to talk more about collaboration, you can email me specifically. I have some information about collaborations. I can connect you to other resources. These are the 2 questions we love to leave people with. Who's doing it better? You can ask yourself that in an editorial meeting. You can also ask your sources, as Michelle was saying, your trusted sources that are working on specific issues like domestic violence, like homelessness. Ask them who they are looking to right now to learn from. And that might be an opportunity to go and to do reporting on that community, on that response, on that organization, to bring that in to make your story a deeper solution story. And also, we always want to be asking ourselves, is there a possible solutions angle to this story? Not every story is a solution story, but to just ask yourself that can take you in different directions and lead to really amazing coverage overall of a really important issue like this moment that we're in right now with this outbreak. These are our emails. Do feel free to follow up with us about specific questions, about other resources you might want to get from SJN. We really, really appreciate your time today, your commitment to solutions journalism. We are here to help you, so let us know how we can do that. And we hope you're taking care of yourself, staying healthy, staying safe. This is such an important time for the work that you're doing to inform people. Michelle, final thoughts?
I'm just really glad that you all took the time to spend it with us, and yeah, reach out to us. As it's been put in the chat that Michael said, we have folks in every region of the US and really folks who are representing the whole world who are here to help you. So reach out. If you reach out to Sarah or I, if you don't know who to talk to, we'll connect you with the right person.
Absolutely. Thanks so much. Good luck.
Bye.